Alright, hi, my name is Tom Leonelli. I'm your PA student today performing your exam. So today we'll be assessing your hip. That's your main joint of concern.
Hurts so bad.
Hurts so bad.
Yeah.
And they're also going to be assessing the lumbar spine and also the knee because those are the joints above and below. So to start out the hip exam, if you can stand up for me please, come over here. And if you can just walk to that side of the room and back, I'm just going to be assessing your gait. Perfect. Alright. You have a seat for me please. Alright, and normally at this time I would be like, she would wear any gown, so I would be assessing the hips anteriorly and posteriorly, noting any bruising or muscle atrophy, which seems to have closed on, so that'd be a lot more difficult. Now let's do some palpation. So if you could lay on your left side for me, please. Alright, now I'm going to flex the knee right here and put it down on the table, and I'm going to be palpating the trochanteric bursa, which is located right about here, noting for any tenderness or warmth. Is there any pain when I press?
Nope.
Nope. Alright. If you can switch to your left side for me, please. Perfect. Thank you. And I'll be palpating the same area, noting for any tenderness or warmth. Is there any pain?
Nope.
Nope. Alright, good. Alright, if you just lay on your back for me, please. We're going to be doing some ranges of motion, and these are all passive ranges of motion. If you could actually just scoot over a little bit to the left. Perfect. Alright, so we got flexion of the hip, we got extension of the hip, we got abduction, we got adduction. Alright, now we got internal rotation, and then we got external rotation. Perfect. And now I'm going to do this with the other leg as well. So you can actually flip over to this side. Thank you. Alright. Now we do the same thing. So we got flexion, extension, we got abduction, adduction, and then upper flexion here. So then we got internal rotation, and then we got external rotation. And then was there any pain with any of those movements?
No.
No? Alright, perfect. Alright, so now we do some of the special tests. You can do, well, I don't want you to slide off. So we'll be doing the Faber exam, Faber test, and I will put the leg right here in this shape. And now I'm going to push down on this side and put my hand on this side, stabilizing the hip, asking if there's any tenderness, any pain in the groin area or SI joint. Is there any pain when I push down?
Not really.
No? Good. All right. I'm going to put this down here. Just switch the leg for me, please. And we do the same thing. Thank you. And stabilizing this. Is there any pain in the groin?
No.
No? All right. And then that'd be indicative of a positive test then. And the last thing would be the over test. So you can just lay on your left side for me, please. And having the bottom leg slightly flexed, we're going to keep this leg straight, and we're just going to lower it down to the examining table. And I'll be assessing, this would be an assessment for any hip or knee pain, and also noting any the tightness of the iliotibial band. Is there any pain when you brought it down? No? All right. And also a positive test would be if the patient was unable to bring it all the way down to the table. You can switch to the other side for me too, and just repeating the exam on the other side, and just bringing it all the way down. All right, seems to be normal. Perfect. All right, and now we're just going to assess your lumbar spine. So if you could actually just stand up for me, please. All right, and I need to face the other direction. And if you could just expose your back as much as you can. Thank you. All right, so we're just going to be assessing the back for any deformities, asymmetry, nodules, or spinal curvature. And then also I'm going to now palpate the spinous processes, noting for checking the alignment of the spine. Seems to be normal. And I'm also going to be palpating the vertebral muscles going parallel to the spine, noting any tenderness or muscle spasms. Do you have any pain when I press?
Nope.
No? All right, good. All right, and for some ranges of motion, if you could just face that way for me, please. So I'm just going to stabilize the patient's hips. If you could flex at the waist for me, so bend forward, perfect, and go backwards, perfect. Thank you. That's extension. And then rotate to your right, and then rotate to your left. And take your right hand and reach down to your right side, and then left hand down your left side. Perfect. All right, so that was the lumbar exam. And now we're going to assess the knee. So if you could have a seat point, please. So first we're going to inspect the knee for any asymmetry, deformities, swelling, or quadricep atrophy. And also if you could stand up for me, please. I'm going to look at the lower extremity alignment and noting for any pes planus or pes cavus for any flat foot or concave foot.
Yeah.
So now we're going to be doing some palpation. So get a seat for me, please. All right.
You need your knees
I
checked
need my
out.
knees checked out. All right. So now we're going to do some palpating of the landmarks of the knee. So we got the quadriceps tendon, we got the patella, we got the patellar tendon, we got the tibial tubercle, we got the MCL, we got the medial meniscus or medial joint space, we got the semimembranosus, semitendinosus, the biceps femoris, the popliteal fossa, the lateral or the LCL, and then we got the lateral joint space, the lateral meniscus. We got the a bursa located right here called pes something. Not really sure what will come to me though. And then we got the fibular head, which is right here. All right. So now we're going to do some other ranges of motion. So if you could just extend the knee for me, please, and then bring it back. Perfect. And then we'll do the same thing. If you just kick out against my hand and then bring it back. All right. Strength is intact in those directions. You can lay down for me, please. And we're going to do another strength test just with the hip as well. So you just bring it up against my hands, perfect, and bring it down. And if you could just like swing it out against my hands and then try to bring it in. Awesome. All right, thank you. Now we're going to be doing some special tests.
Okay.
So first we're going to do the valgus stress test. So we decided to be a little easier to keep it at 30 degrees if we put it under a pillow. So for the valgus stress test, you're assessing the MCL. So then you're going to want to push it out this way and then swing the heel inside. Do you notice any pain at all on that side?
Mm-mm.
No, and I'll be assessing if there's any gapping or gaping in the joint space, which would be like right here. And there's no pain, right?
Mm-hmm.
Perfect. And then the varus stress test would be testing the hold up. The valgus stress test that I just tested should be going the other direction. Should be going this direction. Perfect. Yeah, because that assesses the MCL. So do you notice any like pain in that direction?
No.
So yeah, there's no gaping also noted. So that means it's a negative test. And then for the varus stress test, which I just did, we'll be doing this side, which would be the LCL. Is there any pain on that side at all?
No.
And I'll also be assessing for any gapping of that joint space. All right, so now we will be also doing some other tests. So it would be the anterior drawer sign or the Lockman's test, which would be assessing the anterior cruciate ligament. So I'll keep I should have kept that there. I will stabilize the knee here at 30 degrees and then pull anteriorly on the proximal tibial part of the bone and then just pull. And there seems to be no give at all, so that means that there's no laxity in that ligament. And then if you could just come and sit down for me, please. Thank you. Then keeping her foot planted on the ground, I'm going to stabilize her knee and then push posteriorly on the tibial head, noting for any laxity, which I'll be assessing the PCL. So I'll push this direction. Is there any pain at all either?
Mm-mm.
Good. So that means, and there's no laxity, so that means that there seems to be no injury to that ligament. Now we're going to be doing the McMurray's test. So if you can lay your back for me, please. And this is going to be assessing the menisci. So I'm going to bend her knee up to this point and keeping my fingers at the joint spaces here. See right there. I'm going to internally and externally rotate her foot while extending it, assessing different menisci. So internally rotating it and feeling right here in the lateral aspect. I'm going to extend it and trying to feel if there's any clicks. And there's no clicks. Do you notice any pain at all either?
No.
Good. Because then a positive sign would be if I felt a click in that area. Now if we externally rotate the foot or the ankle, feeling right here in the medial aspect or the medial meniscus, and then pushing down, extending the leg, there's no clicking either. So that's also a good sign.
Great.
So lastly, we're going to be assessing for any effusion of the knee, so any fluid buildup back there. So I'm going to push down. This is called the balloon test. So you push down on the suprapatellar bursa and try to feel on the lower parts of the patella for any movement of fluid, and there is none. So that's good. And then the last one, and then another one, we got the ballottement test, which is very similar, but we push down here and then we push just directly above the patella, like directly on the patella, noting any fluid movement, and there isn't any. And then lastly is just for fluid displacement test. So I push on this side of the meniscus, on the lateral side, noting any fluid movement to the medial aspect, and there is none. And you do the same thing on this side, pushing medially and feeling if there's any fluid movement laterally. All right. And that is all I got for the exam for us today. So thank you
Nice.
very much, Katie, for
Thank
coming
you.
and participating. I
Thanks so
appreciate
much,
it.
Tom. Wow.